Good afternoon, everyone, and welcome to this afternoon's COVID-19 vaccine ambassadorship training, where we'll be talking about helping people experiencing homelessness accept and access COVID-19 vaccines. We're really excited to see everyone here today and know that this is a really important topic as we begin to, as vaccination becomes more available to folks experiencing homelessness, we're able to increase vaccination across our community. So first, a couple of quick housekeeping items. You'll be muted throughout the presentation today. Please use the question and answer feature in your Zoom toolbar to ask a question. That toolbar should be located either at the top of your screen or the bottom of your screen, depending on your Zoom setup. That feature, you'll see a Q&A. You can enter your question there. We may pause to answer questions during the presentation, but for the most part, we'll be holding all questions until the end of the presentation. We have reserved a good amount of time at the end of the presentation this afternoon to answer questions, really kind of engage in a dialogue together. Then if you experience any technical difficulties while we're in the training today, please first try to log out of Zoom and log back in. You'll be able to log right back into the webinar. If you're still experiencing difficulties after you try logging back in, please go ahead and email Austin Puka. Austin has just put her email address and phone number in the chat box. They're also listed here on this page, although this page you won't necessarily see as when you experience that difficulty. So use the chat box to grab Austin's contact information, reach out to her if you're having any trouble. She'll be glad to help you out. Also, before we get started, a note, we know that anytime we attend webinars, one of the first questions for all of us is, are these slides going to be made available? So this session is being recorded and the training recording will be posted on our website. The slide deck is already posted on the website. So if you look there at the lower right-hand corner of your screen, you see a subpage of the TPCH website. That's www.tpch.net/vaccine-toolkit. So if you go to that website, this slide deck is actually already posted there, so you can download it and follow along during the presentation, or you can download it later if you want access to the slides. So then a quick introduction of our presenters today. So my name is Jason Thorpe. I use he, him pronouns, and I'm the collaborative applicant coordinator for the Tucson Pima Collaboration to End Homelessness at the City of Tucson Housing and Community Development Department. We're really fortunate today to be joined by Kat Davis and Luis Murillo. Kat is the Congregate Settings Program Manager at the Pima County Health Department, and Luis is a registered nurse with El Rio's vaccine outreach clinic. So Kat and Luis will both also introduce themselves a little more when we get to their parts of the presentation, but we did want to let you know who would be speaking with you today as we got started. So first, I know many folks have come to this training very excited to learn about how to help people experiencing homelessness access the vaccine. You've also seen us use language like vaccine ambassador or vaccine ambassadorship. And so we wanted to start first by just saying what vaccine ambassadorship means. So when we're talking about vaccine ambassadorship related to people experiencing homelessness, we're talking about a coordinated approach to providing vaccine education and encouraging vaccine confidence, especially among individuals or groups who may experience mistrust or other concerns around vaccination. And I think everyone on the call today probably knows that those concerns and mistrust are especially prevalent among the community of people experiencing homelessness. And I imagine an important part of the reason you decided to join us today. So when we say vaccine ambassadors, who are we talking about? So vaccine ambassadors are really everyday people who provide accurate information about COVID-19 vaccine safety and effectiveness. So we're not necessarily talking about health professionals only. Certainly health professionals are vaccine ambassadors, but our conversation and our approach is really grounded in the idea that we can all be ambassadors for vaccination by educating ourselves and by sharing honest information. In addition to sharing that accurate, honest information, Vaccine ambassadors share relatable personal experiences. So we talk about our own experiences with COVID-19 illness and COVID-19 vaccination, and use that experience to help build trust and confidence with people experiencing homelessness. Another important role that vaccine ambassadors play is listening to the vaccine concerns that people may be expressing and listening with empathy and understanding. So, working to dispel vaccine myths, of course, but making sure that we're validating the concerns that folks may have. And we'll talk a little more about that later. And then when we think about vaccine ambassadorship and homeless advocates, so those of you working directly with people experiencing homelessness in shelters or outreach programs or day programs or housing navigation services or meal sites, right? It's those personal relationships that we already have built with people experiencing homelessness in our community that is the most valuable asset that we can bring to the table in trying to promote vaccine confidence. So that sort of leads to this next point of why homeless advocates? There are health systems all around us. There are public health professionals. There's been so much in terms of resources dedicated into bringing vaccination to the community. And so, what is our role in that? So, because we already have built those trusting relationships with people experiencing homelessness, homeless advocates are uniquely positioned to provide effective vaccine ambassadorship. Right. So we're able to talk with folks who trust us and who may not trust sort of traditional medical services. If we think about in our own community, the work that El Rio has done to bring vaccination into shelters and other settings, right? They've done that through the same team of folks that have been providing medical services in those shelters, because we know that those trusting relationships are key to folks' confidence and comfort and willingness to engage in services. So going a little deeper into this idea of why homeless advocates are such an important piece of vaccine ambassadorship. So if we think about what we offer as people who work directly with folks experiencing homelessness, we really have the deepest knowledge of the needs and experiences of those people. We also have a familiarity with the community resources and services that are available to them. Naturally, we have access to people experiencing homelessness, and not, some traditional medical services may not, or traditional distribution sites may not have that same access and inreach into this community. And then lastly, as I mentioned, those trusting relationships that really are the bedrock of this work. So we bring a lot to the table, and we can really partner with health professionals in this role of vaccine ambassadorship and homeless advocacy. But we also need some things to be able to do that work. So when we think about what we need, so we need factual information about COVID-19 vaccines and their side effects. We need to understand those ourselves. We also need to understand vaccine hesitancy. And so we'll use that language a bit throughout this presentation. And so when we say vaccine hesitancy, what we mean are delays or refusals to accept a vaccine when it's available. So folks having a concern about a vaccine means that they either delay that vaccine or they choose not to get it. So understanding why that happens, right? What are some of the causes of vaccine hesitancy and some of the concerns that people express? And then really knowing effective messages to help people address their vaccine concerns. We can say a lot of things, but there's also, vaccination is not new. While vaccination for COVID-19 is new, there's a long history of research and best practices and proven approaches to helping build vaccine confidence in vulnerable populations. And so our work really wants to draw on that. So we're using messages that we know work. Uh, then an understanding of local vaccination options and registration procedures. So I think most of you will likely agree, for many people experiencing homelessness, willingness is a window, right? And so if someone says, I'm ready to be vaccinated, or I'm ready to enter this service, or I'm ready to get housing, often we have this brief window of time where we can make that happen before that willingness may dissipate. And so really understanding how to get someone access to a vaccine as quickly as possible when they express that they're interested. And then I just want to note here, while we certainly have a role to play, we are part of a much larger picture of people working together and systems working together to engage people experiencing homelessness in vaccination. And so specifically there, I want to call out Pima County Health Department and El Rio Community Health Center, both of which are here with us today and have worked with us in every aspect of developing this vaccine ambassadorship campaign. Also community vaccinators, so organizations like El Rio, but there are many other organizations that are also conducting vaccination in the community. The teams that actually put together the logistics and organize vaccine distribution events, the hospitals and healthcare facilities where folks may need to go if they were to experience a severe side effect or if they were infected with COVID-19, and then people experiencing homelessness. So really knowing that in this work, we're partnering with people experiencing homelessness, we're providing resources and education with the aim of helping them make informed decisions about their own health, not with the aim of coercing them to get a vaccine or to take a specific action, but really to have all of the information and trauma-informed opportunities to explore their own beliefs and make a decision that feels best for them. So before we start talking more specifically about vaccine ambassadorship and then the specific details of vaccination in our community, we want to share some core values of our vaccine ambassadorship campaign. So the first is that people experiencing homelessness have the right to accurate health information and in languages they can understand. And so that means for folks who English isn't a preferred language, in their language of choice. Also, that we're using language that's accessible to people who may not have familiarity with medical jargon. And I think for most of us, it's fairly easy not to get too jargony, only because most of us are also not medical professionals. And so we don't necessarily know the jargon either. Then really recognizing the vaccine hesitancy is common. So it's common in all people. There's nothing unique about people experiencing homelessness being vaccine hesitant. There are some unique considerations and concerns for sure, but this is a really common characteristic and something that we've all probably gone through at some point. And if we think about even the journey of the COVID-19 vaccines, most of us have gone through some process around establishing willingness before we decided to get the vaccine, looking at the research, doing things like that. And so it's important that we're not pathologizing or trivializing vaccine hesitancy, that we're not using language around conspiracy theories and things like that that minimize the importance of the concern to the people we're talking with. Also understanding that trauma histories may influence receptiveness to healthcare. So many folks experiencing homelessness have complicated health histories, may have had negative experiences with medical services in the past. And this is especially true, or can be especially true, for Black, Indigenous, and other people of color who, though there may be those same types of medical past negative experiences, but it's also complicated by racial trauma and a long history of inequitable access to affirming healthcare in those communities. And so really taking time to understand what leads to vaccine hesitancy and validating those very real concerns for people. Our next value being that people experiencing homelessness are able to make informed decisions about their health, right? So when we provide accurate, honest information, when we help folks work through their underlying beliefs, the decisions they make are valid. Then that when someone chooses not to be vaccinated, we need to respect that no as their advocates, and then provide harm reduction strategies that can help them lower risk to themselves and others. And then last core value, vaccines should never be required for someone to access services, and they should never be used to prevent someone from obtaining housing or other assistance. So as we're thinking about how we reshape our social services in light of the COVID-19 pandemic and reopening plans, we should never be using whether someone has had a vaccine to determine whether they will or won't receive a service or housing. So when we think about, I've mentioned now our vaccine ambassadorship campaign a couple of times. And so the Tucson Pima collaboration to end homelessness, we're launching this community-wide campaign to really, that's really focused on these three strategies of educate, engage, and vaccinate. So educate, we're launching today. So this is our first training, right? And so we're providing training and resources for homeless advocates to provide COVID-19 vaccine support and information to people experiencing homelessness. So this community training is our kind of kickoff launch event of that. But then beginning next week, we'll also be conducting training and in-service presentations in shelters, in outreach programs, really focus being able to talk directly with your full team. So I encourage you, and we'll have more details about how to schedule that at the end of the presentation. But I encourage you to bring this back to your organizations and and schedule time for us to come and spend 30 to 45 minutes talking with all of your colleagues about how you can, as an organization, be doing this work. Then engage. So, our plan from a coalition perspective is to equip homeless advocates, folks who are working directly with people experiencing homelessness, to engage those people and start having conversations about vaccine options and concerns, helping to schedule folks to get their vaccines, and then providing the support they need after. And then that third step, right, our ultimate goal is to increase vaccination among people experiencing homelessness. So when because the vaccine has only been available for a short time, we don't have a lot of data. There's been research around vaccine hesitancy on this issue with people experiencing homelessness. But there was a small scale study that showed that about 40% of people experiencing homelessness rejected the COVID-19 vaccine the first time they were offered. Some anecdotal stories from our local community. The first time there were some on-site vaccination events, we were seeing around 50% willingness to accept the vaccine on a first offer. When those providers and healthcare workers started having conversations leading up to those on-site vaccination events and started doing some of this vaccine ambassadorship work to help people be ready for the opportunity of vaccination, then we saw those numbers start to increase, right? And so we know that these conversations are critical. And so our hope is that by helping you be able to have those conversations with the people you're serving in your programs, then we're able to see an increase in the number of people who accept this really life-saving medical option. So then with that, I'm going to turn it over to Luis with El Rio to talk about COVID vaccine information and COVID illness.
Good afternoon, everyone. My name is Luis Murillo, and I'm a registered nurse at El Rio Community Health Center. I'm excited to be here with you today. Thank you, Jason, Kat, and Austin, and everyone watching right now. I'm beyond excited again to be presenting some information on the amazing work that we're doing to provide vaccines to people without a home here in our community. But before I get into that, I want to talk to you guys regarding COVID-19 and give you some background information. I know there's a lot of misinformation going, in different sources. So let's go ahead and talk a little bit about COVID-19. Go ahead and perfect. So let's go back and talk about what is known about COVID-19. So this is what we know, and this source is from the CDC. Infection with SARS-CoV-2, the virus that causes COVID-19, can result in a range of illnesses from mild symptoms to severe illnesses and even death. Symptoms may appear 2 to 14 days after exposure to the virus. What are some of the symptoms? So a patient can actually experience fever or chills, cough, shortness of breath or difficulty breathing, some fatigue, muscle pain or body aches, headaches. These are one that has been new and it's been studying a lot. New loss or taste or smell, sore throat, congestion, runny nose, nausea or vomiting, and diarrhea. Something really interesting that I learned from the CDC is that about 30% of those who actually get COVID have no symptoms. That is why it's crucial for everyone to wear a mask. So again, we don't know how COVID will affect every person. So every person might have different symptoms and it might affect them in a different way. Some people, and this is what we know, some people such as adults 65 and older or people with certain medical conditions are more likely to others to become very severe ill. Next slide, please. So what do we know about the transmission? We know that the principal mode of which people are infected with COVID is through exposure to respiratory droplets carrying the infection's virus. So respiratory droplets are produced when we breathe, when we speak, when we cough, and when we sneeze. Hence why we want to wear a mask so we can protect other people around us. We know that large droplets fall out of air rapidly within seconds to minutes. However, we have smaller drops and particles that can remain suspended for many minutes to hours in the air, and they get dissipated all around through the air. Next slide, please. So what do we want to educate our patients and those around us? So we want to make sure that we tell everyone to keep wearing a mask that covers our mouth and our nose. Again, avoid close contact with others and stay at least 6 feet about 2 arms lengths from other people. The CDC is also recommending, again, avoiding crowds and poorly ventilated spaces. As a nurse, one of things that we tell the patients all the time is to make sure that you wash your hands often with soap and water. However, we can use hand sanitizer that it's at least 60% alcohol if soap and water is not available. It is very important to avoid touching your eyes, your nose, and mouth with unwashed hands. Clean, disinfect frequently touched surfaces daily, and get the COVID-19 vaccine. And we're going to talk more about where to get the vaccine. We have a lot of resources for you guys. Next slide, please.
Hi, everyone. So my name is Kat Davis, and I'm the program manager for congregate settings here at the Pima County Health Department. So I'm going to go through just some vaccine information for you. There are several vaccine options, and so I want to kind of show you what all the options are that we have available in our community. So the 3 vaccines that we have available are Pfizer, Moderna, and Johnson & Johnson. The biggest difference for Johnson & Johnson is that it only requires 1 dose, whereas, sorry, can you go back to the last slide? Pfizer and Moderna both are 2 doses. Can you go back a slide, please? Okay, perfect, thank you. For Pfizer, it's 2 doses, 21 days apart, and Moderna, it's 2 doses, 28 days apart. So the vaccines for Pfizer and Moderna are extremely similar. They do use a new vaccine technology where the mRNA, which is messenger RNA, the part of the genetic code, teaches your cells to make a spike protein from COVID-19. We'll get into that a little bit more later on. Whereas Johnson & Johnson uses a viral vector, which is a virus that acts as a carrier. And that's what gets the genetic information into your cells for Johnson & Johnson. So it's a little bit different modality. For the trials, the actual research trials, here are the demographics for each trial. I'm not going to go into every detail. However, I just want to point out that Johnson & Johnson is the most diverse trial by far. They only had about 59% white people versus 80% or so for Moderna and Pfizer. They're also the only vaccine trial that mentions having any sort of American Indian or Native Alaskan population at all, and they had about 10%. The most common side effects for all 3 vaccines are the same. Pain, redness, and swelling at the injection site. And then systemically, you might have some tiredness, headaches, muscle pain, chill, fever, or nausea. It's really important to note that these side effects should go away within 24 to 48 hours. They shouldn't last for weeks. And then for each trial here, this just shows how many people were vaccinated in the trial. So this isn't real world data or how many people have been vaccinated in the world or in the country. It's just specifically for the research trial. How effective is the vaccine? So Pfizer was found to be 95% effective at preventing COVID again, this is within the research trial. Moderna was found to be 94%, and Johnson & Johnson was found to be 66% effective. All right, next slide, please. So one of the big concerns that a lot of people have with being vaccinated is if there are allergens in the vaccine. So none of these 3 vaccines contain any eggs, as well as preservatives or latex. As far as protection from variants, we know that we have several COVID variants. Oh, sorry, can you go back a slide? We know that we have several COVID variants here in Pima County. And so for Pfizer and Moderna, their clinical trials really were done before variants were widespread around the world. And so the data that we do have for Pfizer is that almost all of Israel, the whole country, was vaccinated using Pfizer. It's about 94% effective in real world use, which is extremely close to what was found in the research trial. And 80% of the infections in Israel are the UK variant. So that's great news that it does seem to be protective against the UK variant, but it did work less well against the South African variant. Moderna was not tested against any of the real variants. They kind of did some trials to try and test how it may work with a pseudovirus, but we don't really have a lot of data for Moderna. Johnson & Johnson, on the other hand, was created like a little bit later. And so the variants were more widespread at that time. So they were also tested in South Africa as well as Latin America. And so there's a lot more information about how Johnson & Johnson can protect you from variants. So it's about 64% effective against the South African variant, but it wasn't tested as widely against the UK or Brazilian variants. So the best news about all of these is that every single one has protected in the trial, everyone 100% of people against against hospitalization or death. So this is why vaccines are created, right? We want to prevent death. That's why we don't have vaccines for things like a cold, because it's not life-threatening usually. And so with COVID, to show that 7 to 14, they all kind of use different timelines, but 7 to 14 days, 14 days, or 28 days after vaccination, it is 100% effective within the trial at preventing hospitalization and death. So that's amazing news for all 3 vaccines. Again, this is not real world data, so it's really rare to be able to say it's 100% of anything. In the real world, there have been people who get COVID after being vaccinated. So just keep in mind this data is based on the research studies. And then protection from severe disease. So severe disease is categorized a bit differently than hospitalization or death. So this shows you kind of the percentages that were protected against severe disease. So only one person in the entire Pfizer trial was categorized as severe disease after vaccination. So one person out of like 18,000 people, it's not so bad. Same with Moderna. They had about 30 people in the placebo arm, 0 people in the vaccine arm. That's the only one that can say it was 100% effective against severe disease. And then Johnson & Johnson, a little bit less, but close to 75% effective against severe disease. And the sources are linked at the bottom from the CDC and the FDA, if you want to check those out. So next slide, please. All right, so let's talk a little bit more about mRNA versus viral vector vaccines. So mRNA vaccines are new vaccine technology for authorized vaccines. However, this technology has been tested for years and years in vaccine research. So spike protein, oh, sorry. Can we go back a slide? Okay, perfect. So spike proteins, this is a little picture of COVID-19 here in the corner of the slide. And the spike proteins are literally those little spikes that are on the outside of the virus. So that's what I'm talking about when I say spike proteins. So those are on the outside of the COVID-19 virus. Scientists discovered the genetic code that codes to create these spikes. And that code, the mRNA, is wrapped in lipids, which are just fats, and that's what's in the Pfizer and Moderna vaccines. Once that's injected into your body, the mRNA code is read by your cells, and your own cells begin producing these spike proteins. So they're not producing the entire virus. There's not genetic code for the entire virus. So it is impossible to get COVID-19 from any of these vaccines because COVID-19 virus is not in the vaccine. But they begin producing these spike proteins, and then your cell displays the spike protein on the outside of the cell surface. Your immune cells see that spike protein on the outside of your cell surface and recognize it as being foreign. It doesn't belong in your body. And an immune response starts. Your immune system starts destroying cells that are displaying the spike protein. And that process of destroying the cells creates antibodies. Antibodies remember. So then next time these spike proteins are found inside your body, like if you were infected with the real COVID-19 virus, it remembers how to fight them off and will kill off the COVID-19 without you getting sick. So once the cells read the mRNA, they break down. So they're disposing of the mRNA and the cell itself. So that means that the mRNA never gets into your own DNA. It's not changing your own DNA. It never gets into the nucleus of the cell, which is where your own DNA is held. The viral vector process is really similar, except it uses a harmless virus. In this case, it uses an adenovirus, which is also really commonly used in vaccine research. And this viral vector carries the genetic material into your cells. So this viral vector, the adenovirus, is deactivated. It's not going to get you sick, but they fill it with the COVID-19 genetic information, and that's how it gets it into your cells. Beyond that, it's a really similar process. It gets into your own cells' machinery. They begin producing the COVID-19 spike proteins again. Those are displayed on the outside of your cell. Your immune system recognizes them as foreign and begins fighting them off. So once they get into your cell, the three vaccines are all working very similarly, focused on those COVID-19 spike proteins. You can go on to the next slide, please. So some key points, all of the authorized vaccines are extremely effective in preventing hospitalization, severe disease, and death. So again, this is what vaccines are for. It's not just to prevent sniffles or mild illness or even asymptomatic illness, but to prevent people from dying. So it's definitely doing its job. So it's great news. None of the vaccines contain the COVID-19 virus, so it's impossible to get COVID-19 from the vaccine. And any vaccine that's offered to you is the best vaccine. The soonest you can get vaccinated is the most important piece. And so definitely take any vaccine that's offered to you. That's your best bet at preventing illness or death. Next slide, please. So I'm going to go do a little demonstration about how you can access vaccination for your clients or for yourself. So El Rio is going to be going to lots of different, sorry, let me minimize this real quick. El Rio is going to lots of different service providers in town and offering vaccines. They'll be using the Johnson & Johnson vaccine. So that's absolutely an option for your clients. However, if they prefer a different vaccine or they just prefer going elsewhere to be vaccinated, then they have that option as well. They can go to any community pod in Pima County and get vaccinated there. So I want to walk you through the registration process so that people, you guys have an idea of how to walk a client through this process of getting registered. It's a bit complicated, so I'm going to try and give you an overview of 3 different registration processes. So the most important thing is that you can go to pima.gov/COVID-19 vaccine, and that's going to take you to the Pima County vaccine webpage. So on this webpage, you can see here that anyone 16 and older in a congregate setting or experiencing homelessness is part of our 1C vaccination priority group. And that opened March 25th. So anybody experiencing homelessness is now eligible for a vaccine. This will be changing. This morning, the Pima County Health Department announced that as of Monday, April 5th, anyone 16 and older is going to be eligible for vaccination at any of our county sites. It's been that way at the University of Arizona site for a little while now, because that site's run by the state. But we are now opening all of our county sites also to anyone 16 and older. So that change will be happening Monday. But on this webpage, you can see, you can make an appointment here for Banner or Keno. This is for TMC or the Tucson Convention Center. And then down here is the link to register for the state site, which is at the University of Arizona. I also want to mention that I know a lot of you work with veterans, so they can also sign up here to get the vaccine through the VA system. So that's also an option. I honestly don't know anything about the registration process, but that is an option for them. So the only time that they're going to need to do this registration process is if they're deciding not to get vaccinated by El Rio at one of the events. For those, El Rio is vaccinating or is registering on site, and so they don't need to do any pre-registration process. So really the registration process depends on where they want to get vaccinated, what site they want to go to. If you're working with youth, 16 and 17-year-olds are eligible for vaccines, but then in that case, they have to go to either Banner or the University of Arizona. Only Pfizer is approved for vaccination in anyone below age 18. And so only Banner and U of A have the Pfizer vaccine available. So we are going to start with, let's start with this system. So this is for TMC or TCC. This is a pre-registration form, and it's important to know that for all of these registration systems, an email address is required. I know a lot of your clients have email addresses, but if they do not, then you can quickly make them one for free, and then it can be used for this vaccination process. So we are going to choose English. So when you go in, it's pretty self-explanatory. This first page is, this is all demographic information. So we can just put some information in. If it has an asterisk, that means that it is required. This is not required. So let me just make up some information real quick. And then we can go to the next section. So when you put in your information, this is also going to check the address for you so that you can, it'll make sure it's correct, basically. So you could use a shelter address here if that works for you. And then this is a really important question. So this is asking if you've received your first vaccine dose or not already. If you say no, it will just go on to the next page. If you say yes, there are some follow-up questions. So we're going to say we are not vaccinated yet. So this is what I'm talking about. It will check the address to make sure that it's correct. So currently there are questions about you know, where you live, what kind of risk you have, if you have a disability or not. A lot of these questions as of Monday are going to go away because we're opening up to everyone. They won't have to qualify for vaccination. So a lot of these will go away. So just know Monday it'll look a little different, but hopefully it'll make it even more simple to get vaccinated. So they can click, you know, any of the stuff will make them eligible, basically. So whatever their health conditions are. And then it's asking if you have anyone caring for you in the home. So you can say no. This question is specific for people who need vaccination in their homes, who are unable to get to a vaccine site. So hopefully that does not apply to anyone. And then click this to confirm that you are not a robot, and then you can submit it. So that's all you'll need to do. They will then receive an email from MyChart, and they'll have to go through MyChart to actually make their vaccine appointment. This whole process is like a pre-registration that will then be sent over to TMC for either the TMC or TCC site. So that's that registration system. Let me go show you the banner system really quickly. So if they want to go to banner, down here, again, it's just basic demographic information. Here's the eligibility criteria. Sometimes it takes our sites a little bit longer to kind of update their eligibility criteria, but even if you wanted to sign up today, people experiencing homelessness who are sheltered or unsheltered, either way, are eligible. And so they can just click, yes, they meet the eligibility criteria. And then again, select that here and then go on to the next slide. So that's kind of how, this is what the banner registration system looks like. And then I'm going to go into the state registration system really quickly. This is definitely the most complicated registration system. So first, you're going to scroll down here to the patient portal. It's not super obvious, but if you read here, it does say if you want to register for the University of Arizona, then use the patient portal. So we're going to open that. And this is what it looks like. So the first thing you'll have to do is create a new account. So I have some slides to kind of show you what that looks like. So I can stop sharing and we can switch back to the slide deck. And these are all the links. So all of these links and phone numbers can be found at this Pima County webpage, but I also have direct links and direct phone numbers. So there is registration assistance over the phone for anybody who's not comfortable using the internet. So you can go to the next slide. Perfect. So with the state system, when you click that you need to create a new account, put in your email address and you'll receive an email that looks like this. It's going to have a link here for you to click on. And you can go to the next slide. Once you click on that link, then it's going to take you to a box that looks like this where you have to verify your account. You're going to put in your email address again. It's going to send you a verification code. You'll have to go back into your email where the verification code is and get the code out of your email. And then you can go to the next slide. Then you want to go back to this box where you have already typed in your email address and you're going to put that verification code in and click verify code. If it all works properly, it will say the code has been verified and now you can continue, and you just press the continue button. If the code didn't work for whatever reason, you can click the send new code button and go through that process again. You can go to the next slide. Then you have to create a password. Here's all the rules, all the requirements for a password. They have to have letters, numbers, uppercase, lowercase, and a special symbol. So bear that in mind when you're creating a password. And then once the password is created, then you can hit continue again and go on to the next slide. And then it will take you back to the same login where you had originally started. But instead of creating a new account, you can just click the login button. And you can go to the next slide. So this is where you begin to actually schedule your appointment. So you click this little book appointment button. This is what the screen's going to look like. And you click book appointment. After that point, you're going to enter your demographic information like you do on the other websites, including your preferred language. If they have a phone, they can opt in to receive text reminders for their appointments. It will also ask for insurance. A lot of these systems are going to ask for insurance information. You can click no that you don't have insurance, but there's never going to be any cost to the patient, whether they have insurance or not. If somebody has insurance, then the vaccinator can bill the insurance for an administrative fee, but there won't be any cost to the actual patient. the system does ask if they live in a shelter or other congregate facility. I think that's just for research purposes, maybe, because they're already accepting anyone over the age of 16. So that's not a eligibility question in this case. And then after that, you're going to actually schedule the visit at the University of Arizona. You will receive an email confirmation at the very end with your appointment information. So that is all for the University of Arizona site. I know it's a little confusing, but you are able to have these slides. So hopefully it can kind of walk you through the process if this is where somebody chooses to get vaccinated. So those are all of our vaccination processes. Again, El Rio will just register people at the sites when they arrive. There's no pre-registration necessary. And so they only need to go through this process if they decide that they want to go get vaccinated elsewhere. So that is it for me. I believe you can go to the next slide. Great. Thank you, guys.
Thank you, Kat. So now I'm going to go ahead and talk to you about the work that El Rio is doing regarding the distribution of the Johnson & Johnson vaccination. But before I do that, I want to start by saying thank you to El Rio and all the amazing staff that has been working really hard to make this possible, from our doctors, nurse practitioners, medical assistants, and nurses, our licensed professional counselors, and all the staff. It takes a lot of work, but we have an amazing team. So I'm going to start by talking to you about the Health Resources and Services Administration and how they give us a grant to be able to accomplish this. So at the beginning, the Health Resources and Service Administration selected around 250 health centers to be able to provide vaccines to those underserved populations, and El Rio was selected as one of those. Since then, the Health Resources and Services Administration, along with the CDC, added 700 more entities. And so far, 950 entities are actually doing this amazing work. And I'm very proud of El Rio because we're helping our community in Southern Arizona, Tucson area, and I'm really proud of all my team. So I'm going to go ahead and talk to you about the COVID-19 vaccine distribution and how we are implementing our project. Next slide, please. So I'm really proud to say that El Rio Center is a partner of our community. We've been here more than 50 years, and we're still continuing to work really hard to ensure that our population, our community can have health services based on their needs. So our goal is to ensure that every individual in our community experiencing homelessness have access to a COVID-19 vaccine. I'm really proud to say that El Rio has administered more than 500 Johnson & Johnson COVID-19 vaccines to the members of the Tucson underserved communities. And so far, we have worked with the following partners of our community, ranging from the Salvation Army, Casa Maria, Gospel Rescue Mission, Women's Recovery Center, La Frontera, Primavera Foundation. We are really proud to be serving them and helping our community. Next slide, please. So let me talk to you about the target Johnson & Johnson distribution and how we are implementing and how we're making this work for the community. So we have an amazing outreach medical team, again, composed of nurse practitioners, we have doctors, we have medical assistants that provide medical care on a daily basis. And they are the ones who assess the population and determine vaccination needs. They experience firsthand what the population needs. They ask questions, they inform them, and then based on the information they collect, the outreach medical team talk to our medical director. So our medical director ensures that we have equity in the Johnson & Johnson vaccination distribution. That vaccine allocation is established by data provided by the outreach team. So again, the outreach team talks to our medical director, and from then we make a decision, or they make a decision. So the next step is to talk to the regional director, the nurse manager, and then the RN lead. And the medical director communicates the vaccination team the allocation plan for the week. So the team organizes, and then we probably vaccinate the community. So on a daily basis, we go to different sites. And again, we don't have a specific number of people. We have an idea of how many people we might be possibly seeing on a daily basis, but sometimes we have more, sometimes we have less, but we are prepared to actually distribute those vaccines. Next slide, please. So I want to talk to you regarding building vaccine confidence, but before I do that, I want to talk to you some of the concerns that we encounter for those people without a home. I think the first problem that we encounter is the lack of education. As you know, most people don't have good resources out there, and there's a lot of misinformation. People hear what other people are saying, and they don't have concrete and valid information. So this is one of the problems that we've been seeing along the way. Also, medical health conditions have been a problem that we've been encountering with the people without the home. Thankfully, we have very good licensed professional counselors that have been on top of this, and they've been providing a lot of good resources for us and a good training to understand the needs of our community. Language barriers. We have a lot of people that don't speak English, and luckily we have a lot of staff members that are bilingual and are able to provide medical services in their own language. Cultural barriers, this is another problem that we have encountered. Most people have never had a vaccine in their lives, and if they did, it was years ago, so they don't believe in vaccinations. One of the problems that we've been encountering is the fear. They have a fear about the vaccine. It doesn't work. The government is trying to, control me. And again, we have our outreach team is really good at explaining and providing valid information for our community. So how do we help our community to feel comfortable about getting the vaccine? First rule is to establish a trusting relationship. Our outreach team has been really good because they've been helping them along the way. Even before COVID started, they've been with them all along the way. So there's a trusting relationship happening at that specific point. So thank you to our outreach team for doing that. Make sure that we acknowledge the individuals as a human being. Make sure we talk to them, listen to their personal needs, and most importantly, acknowledge their fears and understand their emotions. Again, there's a lot of misinformation and there's a lot of fears. Everyone, this is new for everyone, and we're learning along the way. And just imagine having a situation where you don't have a home and then someone is telling you now you have to get a vaccine. So we want to make sure that we provide, again, valid and good information for our community. It's very important to create a judgment-free environment, an environment that is comfortable for the community. Use simple medical terminology. And this is something that I learned from our licensed professional counselor. Incorporate words and phrases that the patient has used. So listen to them and then ensure that you use their own language. In that way, they're going to get comfortable with you and then be able to trust you. And then explain the benefits of a one-time vaccine. So the Johnson & Johnson vaccine is only one dose, which means that the patient doesn't have to come back to the clinic in 2 weeks like the other vaccines, or 3 weeks, sorry. Something that I'm really proud to say is that so far, like I said, we have distributed more than 500 vaccines, and we haven't seen a lot of side effects. So this is something that the population has been liking, that they're not experiencing a lot of major side effects and they feel comfortable. So again, explaining the benefits of the one-time vaccine, it's a crucial point for us to ensure that, the people get the confidence that they need. Next slide, please. So El Rio has been providing vaccinations to the general public. So those who are 55 and older qualify for the vaccine. So if you are a member of El Rio Clinic, you are also able to register and be able to get the vaccine. So in case you come across a patient that doesn't know where to go, we are providing that service too. I'm not really sure when we're going to open to the entire public and when we're going to get rid of all the restrictions. But at this point, anyone that is 55 and older can go ahead and register using elrio.org. And again, it's the same process as CAT use. It's a very simple process. Going back to the outreach clinic, I would like to explain that the patient doesn't have to pre-register. We do all the registrations when we go to the sites, to the shelters. So we help with the registration process, and then we do the vaccination on site. Next slide, please.
Perfect. Thank you so much, Luis and Kat, excuse me, for that really informative and useful information about accessing the vaccine directly. So we're going to spend the rest of our time talking primarily about real tips homeless advocates can use to be talking to folks about COVID-19 vaccination. But before we do that, we're going to watch a brief, about 8-minute video made by our partners over at the CCHS Foundation. If you aren't familiar with that, it's the Certified Community Health Specialist Foundation. They are the good folks behind everything that happens to support people experiencing homelessness at Z Mansion. And so they've produced a short video for us that gives us an opportunity to hear directly from some people experiencing homelessness about their feelings about the vaccines, as well as some useful tips for answering questions about vaccine concerns or fear. And so we'll play that video. I also do see plenty of questions are coming in the Q&A feature. That's fantastic. Please continue to put your questions in there. We've got a good amount of time held at the end of the session where we'll answer all of those questions. And now we're going to go ahead and watch the video.
In 2009, Canada faced a raging swine flu pandemic. While the pandemic would go on to infect over 10% of the country's population, one segment of the population fared far better than others. That's facilitated the vaccination drive. First, the homeless were prioritized for early vaccination. Second, information about H1N1 and the vaccine was widely distributed to clients at popular services. Third, vaccination clinics were held at services already frequented by people experiencing homelessness. The homeless were not required to travel to receive a vaccination. And fourth, vaccinations were administered by street nurses who had already built relationships and trust with clients. As we face the COVID-19 pandemic, we'll hear from the homeless as we examine how to approach issues when vaccinating this population.
What do I think about the being prioritized for the J vaccine? It's excellent. It's just the greatest thing. It's basically, I have a disease and they have a cure. Of course I'm going to take this, and if you don't take it, my gosh, you are a retard. It's just stupid. You got a disease that could kill you. Here's a pill that could cure you, but you're not going to take it. I'm going to take it. Using my head. That's what I think about being prioritized for receiving the vaccine. Thank you so much, Johnson & Johnson.
First of all, I don't even believe in, I'm still trying to convince myself there's a COVID-19. And once I convince myself of that, I guess maybe I don't want to use the example of having to lose a friend to convince myself. Maybe there's another way I can look around and find out, oh my God, it does exist.
When faced with COVID denial, stay respectful, stay positive, and feel free to share your personal story. CCHS volunteers have found stories of personal COVID experiences have been very successful in reaching out to COVID deniers.
Okay, so I don't believe in the vaccinations because I could see some zombie shit happening, some Resident Evil type things happening. They're good.
For Resident Evil believers, feel free to share your personal zombie stories as well.
So I am concerned about the fact that the vaccine happened so quickly. And we've had other vaccines that have taken years.
The COVID vaccine was built using years of research on two similar coronaviruses named SARS and MERS. In addition to those many years of research, millions of people have already received a COVID vaccination without any issue.
Will it make you sick when you take that shot, like the flu shot?
Instead of starting by listing all the possible side effects, CCHS volunteers have found it better to start by sharing their own COVID vaccination experiences. After honestly sharing the good and the bad effects of the vaccine, CCHS volunteers then take as much time as needed to fully answer all questions. In reality, most of our discussions with the homeless about the COVID virus and the COVID vaccination have been very, very positive and usually go something like this.
Okay, so we're going to have the J&J vaccine against COVID here on Thursday. Would you like to get it?
Yeah, I think so.
Great. What have you heard about the vaccine?
So far I've heard it's one dose and it's supposed to also take care of the variants. So that's pretty much what I know.
Are you worried about any of the side effects?
Not really. I haven't seen any really published or anything talked about it. So, you know, seems to be okay. Maybe a headache or something, I guess. You know, I can deal with that.
And one final note from the streets. Because of the high level of kidney and liver issues in the homeless population, let your patient know they should talk with their physician before taking any OTC pain meds. Now let's take a moment to review. What if your homeless patient asks, are we getting the crap stuff just like always? No, absolutely not. The J&J vaccine is a proven vaccine that even the rich are struggling to get. No, you're actually being brought to the front of the line. Everyone else has to wait. No, you are very important. Remember, they've spent over $1 billion to get the vaccine to you. Now, what if your patient asks, does COVID even exist? Yes, COVID exists. I've had it. I got really sick and I don't want you to go through what I went through. People I care for got COVID. They say it's painful and deadly, and they don't want anyone to get it, ever. President Trump even had it. He needed oxygen and had to go to the hospital. Now, he's had the vaccine as well. Now, what if your patient asks, I'm concerned the vaccine was rushed. Was it? No, not at all. The vaccines are based off of years of research on similar viruses. This gave them a very safe head start. Almost 150 million people have received at least one shot. 150 million people, and there have been very few serious side effects. Thousands of people who did not get the vaccine, unfortunately, are dying every single day. One shot of the J&J vaccine would have saved them. Finally, what if your homeless patient asks, I'm concerned about the side effects. Are they bad? No. In fact, I got the vaccine, and all I had was a sore arm. The shot itself was completely painless. My wife had the vaccine, and all she had was a tiny fever and a slight headache. Both went away with Tylenol. My folks had the vaccine, and mostly it was just a great relief for them. Now they know they won't ever get sick or die from COVID. Finally, once your homeless patient is vaccinated, thank them and tell them to share their story with their friends. Together, we can beat COVID.
So then before we go on, I do just want to let folks know that video, again, produced by CCHS Foundation, our partners that do all of the work with folks experiencing homelessness over at Z Mansion, is available on the website here, the tpch.net/vaccine toolkit, as well as on TPCH's YouTube page. So we encourage you to share that with your colleagues, the folks in your organization, as a kind of introductory primer to the topic of vaccine ambassadorship. So as we move into thinking about how we as homeless advocates can really play a role in this work, I want to touch again on some of the kind of common themes and concerns around COVID-19 vaccines that we're hearing from people experiencing homelessness. Many of these Luis mentioned a few minutes ago, and so we'll just kind of as a recap here. So we see often themes around misinformation or lack of basic knowledge. So folks who maybe say the COVID vaccine or COVID isn't real, or I can't afford the vaccine. Someone doesn't know that the vaccine is free even if you don't have health insurance. Perception of risk. So I'm healthy, I won't get sick, or my risk of exposure isn't that high. I camp by myself. I follow all the social distancing guidelines. Why do I need to get a vaccine? Folks who maybe are mistrustful of the vaccine, have concerns about its safety. Here we hear, and you heard in the video, concern about the vaccine being rushed. We also hear things in this area around maybe the vaccine will change my DNA, something that Kat mentioned earlier that we know is untrue. All sorts of theories have moved through social media particularly. So concerns around there being a microchip in a vaccine, or it being attached to 5G, or the government tracking folks. So we know, particularly with folks who maybe are experiencing severe mental illness, some types of psychoses, substance use disorders, et cetera, some of those messages can be taken really to heart. And so there's important work around helping folks understand the truths about the vaccine. Also, medical concerns and history. So perhaps one of the most common, and certainly not unique to folks who are experiencing homelessness, is I hate needles, right? So I don't want to get the vaccine. I'm afraid of needles. Or I have an underlying health condition and I don't know whether I can get this vaccine. Then we see concerns around symptoms and perceptions of severity. So again, that idea of I'm healthy, I don't need it, or I already had COVID-19, it wasn't that bad, or someone else I know had COVID-19, it wasn't that bad. This idea that for most healthy people, the symptoms may not be so severe. And so if I'm healthy, there's no reason for me to get the vaccine. Then racial trauma and health inequity. So here we see we could see locally when we think about our own community. So I'm not a citizen. I don't think I can get the vaccine. I don't have access to affirming healthcare, right? So folks who maybe I can get a vaccine, but I don't feel safe in the medical settings. And then here in our other training, in our toolkit resources, you'll see greater information here. I think as we're talking about vaccines, particularly with folks of color, to be really cognizant of the realities of racial trauma. And I imagine if you've been following these kind of conversations about racial trauma and vaccination in the news or in just kind of popular media right now, we tend to be only referencing the sort of historical incidents of medical abuse and mistreatment and experimentation in communities of color. And that is very, very real and absolutely contributes to racial trauma. But also every aspect of our current health, of our health systems, of our housing systems, of our society, continue to inflict racial trauma on people of color every day. And so recognizing, and when we're talking about vaccine concerns related to racial trauma, that we're coming from a place of understanding that we have systems that have broken their trust with communities of color, not that we have communities of color who have adopted mistrust of those systems. And so really understanding the very real impacts of racial trauma and the validity of those concerns. And then religious and spiritual concerns. So here we see folks maybe saying that their faith doesn't allow vaccination, or that there've been issues around the use of stem cell research and fetal stem cells. And so understanding where folks are coming from with that, and also having some basic understanding of where various faiths positions on vaccination lie. So most communities of faith are encouraging vaccination. There are some exceptions to that, but those are also very real vaccine concerns and that need to be honored. So when we think about talking about vaccine hesitancy with people experiencing homelessness, the first thing we want to do is start from a place of empathy, right? So we know that emotions are high for all of us, right? The pandemic has taken a toll. I don't think any of us thought back in February of 2020 that we would be here in April of 2021, just beginning to think about what life after COVID-19 might look like. Also acknowledging the stressful nature of the pandemic and how that's impacting people. So certainly we're experiencing collective trauma, and that's exacerbated for many people experiencing homelessness. If we think about the messages that we say to protect yourself, stay away from other people, don't try not to use things others are using. And then we think about the experiences of people experiencing homelessness who often rely on public transit to get around or staying in congregate shelters. Right, so we know that there's additional stress simply because even if folks were trying to take the most responsible actions they could, there's increased exposure risk to people experiencing homelessness. Then honoring the voices of Black, Indigenous, and people of color, and others for whom the trust in the medical establishment has been broken. And recognizing, and I mentioned this before, really recognizing that vaccine hesitancy is common. And so it's not a moral or an intellectual failing. It's a process we all go through when we're confronted with making a decision about our bodies and our health, about which we may not have a lot of information. And if we think about misinformation and how it's spread throughout the community, right? Like in any language, at any literacy level, the misinformation about vaccination is everywhere, right? We can find it in social media, we can find it in conversations with anyone, right? Those mistruths have spread very quickly. But folks with limited English proficiency, with limited literacy, who may not have access to news media, other sources, or looking online, have the capacity or the access to be able to do their own learning in those ways, the accurate and fact-based health information may not have reached them. And so really recognizing that many of us have had the opportunity to go through a journey and really paying attention to what's happening with vaccine development and being able to do some research. And that may not be true for the folks that we're serving. So then thinking about how we talk to folks, right? So providing truthful education and information. So really beginning from a place of honesty. And so some key tips here are discussing how widespread vaccination will end the COVID-19 pandemic, right? So most folks here have probably heard the term herd immunity by this point, that idea of there being enough people with immunity in the community that even small outbreaks can't kind of catch like wildfire. And so one of the key strategies is for us to be able to build that herd community and be insulated from the risk of epidemic or pandemic spread is widespread vaccination. Then explaining the vaccine basics and really focusing on the safety and effectiveness of each of the COVID-19 vaccines, especially in preventing severe illness and death. So Kat mentioned this a bit in her presentation earlier. While there's various effectiveness across the three vaccines as it relates to preventing transmission of COVID-19, all three vaccines are nearly 100% effective in preventing severe, serious illness, disease, or and hospitalization and death. So focusing on that, on the life-saving nature of the vaccine. Describing honestly the known side effects and what people can expect when they can get vaccinated. And then sharing our personal experiences. And so this is so important, like sharing personal experiences related to COVID-19 illness and vaccination in honest ways, but also being really conscientious that we're not sharing stories that may be traumatizing for people experiencing homelessness, or may put, or maybe veiled attempts to guilt someone into being vaccinated, right? So I would never want to be like, my mother died, and so you should get vaccinated because people like my mom don't die, right? Like, not high pressure tactics, but relatable stories that help to say, here's why I believe the vaccine is important. This is why I'm confident in it. That's why I've made the decision to get vaccinated. And so those personal stories really are, the crux of effective vaccine ambassadorship, and also the reason that we as homeless advocates have such an important role to play here, because we have those trusting relationships. So I'll come back to that again, right? So sharing our own stories matters when we're in relationship. It matters far less when a stranger tells us their story. So if we're talking, continuing to talk about vaccine hesitancy, thinking about listening attentively, right? So really listening to what folks have to say about their vaccine concerns and fears, honoring and validating all of those concerns or fears, and encouraging questions, right? So the more we talk about it, the more we can learn. The more we learn, the more likely we are to build confidence. Then, so validating the experiences and fears that lead to vaccine hesitancy, and then offering to schedule vaccine appointments for folks to help them get vaccinated, or if someone wants more information or needs to be connected to a medical professional, offering to do that work, letting them know when you can get back to them, and then following through, right? So that's this really critical piece. I think everyone on the call, having worked with people experiencing homelessness, knows, and all of us may be guilty of at some point, having made a commitment to support someone in some way and then not following through on that. And so we know trust is so critical to this. And so making firm commitments, letting folks know what to expect, and then delivering on the promises we make. And to that end, not making promises we can't keep. So then lastly, and this is that reminder to rely on professionals for medical advice. So homeless advocates have a great role to play when it comes to promoting vaccine confidence. We can share this accurate information, basic education about vaccination. We can help people register for vaccines. We can help them prepare for appointments, work through their fears. We can share our personal experiences, but most of us aren't medical professionals. And so we want to make sure that when folks have specific medical questions, or really need to thinking about underlying health conditions, other medications that maybe there's an interaction, fears like that, that we're referring them to appropriate health professionals, and whenever possible, that we're connecting them to health professionals with whom they already have a relationship. So if they've worked with an El Rio street nurse before, right, reconnecting them to that nurse to get those questions answered, someone they have some trust with. But when those folks don't exist, then still getting them connected to medical professionals for those answers. So then an important note here, and if I were to be honest, if I were to choose where we put this in any other time, I would say this should be the first slide we ever say, which is, right, so we're doing all of this work to promote vaccine confidence, to encourage people to get vaccinated. But we also need to be really mindful to honor no, right? So every one of us has a right to make decisions about our own healthcare. And none of us would appreciate being told that we had to be vaccinated, or being pressured by people we know or care about. And so it's really important in our role as advocates to remember that we, not to take paternalistic roles. It's not our job to force someone to get vaccinated. It's our job to help them have all of the information they need and can use to make a good informed decision for themselves. And so when we think about our own journey to the decision to get vaccinated, and I hope most folks on this call, if not all, have chosen to be vaccinated and either have already been or are planning to once it's available to you, that decision really requires us all to take a bit of a step of faith, right? This is not the same vaccine development process we've seen in the past. It's not, we don't have an experience with a pandemic like this to reference before in our lifetimes. And so we have to make this decision to trust, right, in a time when the misinformation is abounding. And so that's especially true for folks who are experiencing homelessness. And so their willingness is probably going to take a process and some opportunity and time to think about their options, and then to make a decision before they actually get that shot. And so we want to recognize and honor that. It's part of the reason that a large part of the reason that we're launching this campaign and wanting to work with your organizations is that we know that giving lots of information and opportunity to talk and think about vaccination before there's someone in front of you offering you a vaccine will increase your likelihood to accept that vaccine when it's offered. So then if someone says that they don't want to get vaccinated or they don't want to talk about it today, we always want to try to keep the door open for continued conversation, acknowledging again that it's a process. So ask for permission to check in with them again in a few days and let them know that if they want to talk about it or change their mind later, absolutely you're there to do that with them. But again, that reminder, it's not our job to make their decisions. We want to empower people experiencing homelessness to make their own decisions based on the best information and what's real in their lives. And that means respecting their decision to say no as well. So I mentioned before, if someone says no, that we want to be thinking about practicing harm reduction. And so then you might think to yourself, like, how can someone practice harm reduction related to COVID-19? How can we reduce our risk of exposure and illness? And the answer, right, is the same things we've been doing since the beginning of the pandemic. So while we were waiting for a vaccine, what we were doing was practicing harm reduction. And so wearing a mask that fully covers your face and your mouth and your nose, avoiding close contact, staying 6 feet apart from other people whenever possible, avoiding crowds or poorly ventilated spaces, washing hands with soap and water, using alcohol-based hand sanitizer if you don't have access to soap or water, avoiding touching your eyes, nose, or mouth with unwashed hands, and cleaning and disinfecting frequently touched surfaces as often as possible. So we wanted to review a few key messages in conversations. And so these are some of those effective messages that we know work based on research that's been done with other vaccines and vaccine hesitancy. So the first, communicating clearly that COVID-19 can cause serious illness and death. While some people may experience mild symptoms, others can experience very severe symptoms and could die. And we don't know who will get very sick and who will not. The vaccine keeps us safe. So this one shot, even if I hate needles, even if I hate going to the doctor, if I'm afraid of healthcare, when I compare the time and sort of trauma it takes to get vaccinated versus potentially being hospitalized and on a respirator, right? The vaccine keeps us safe and is such an easier choice. Then also the vaccine is safe and effective. And we want to be able to highlight that as often as possible. Each of these vaccines are safe and effective, especially when it comes to preventing serious illness and death. Vaccine trials included thousands of people, including racially and ethnically diverse participants. And so we often will talk about trials, and when we hear people express vaccine concerns, right, most often we'll hear about a small, the vaccine trials weren't very large, there weren't that many people, and certainly there was also some very legitimate critique of the diversity within the vaccine trial groups, right? So there was work done in that area, but it certainly left some to be desired. So while we think about that trial group, then it's really important that we're also reminding ourselves and sharing with others, while tens of thousands of people have participated in trials, millions have taken the COVID-19 vaccine, and most have experienced only mild side effects for 1 or 2 days. These side effects that were mentioned earlier, I think Luis shared, so maybe some pain in the injection site, mild flu-like symptoms, headache, nausea, something like that, maybe for a day or 2. And so really focusing on how many people have been vaccinated in our community. I think another really meaningful point right now that Luis shared earlier is that in our community, over 500 people have been experiencing homelessness, have received the COVID-19 vaccine, and none have reported serious side effects. So if I'm thinking about building my own trust and confidence in this vaccine, and I'm told that 500 other people who have lives similar to mine and who live in my town have all taken this vaccine and none of them have experienced serious side effects, that's going to help dispel sort of my fear around that vaccine. Reminding folks that getting the vaccine protects you and protects the people around you. So it is both selfish and selfless at the same time. And so we want to protect ourselves, and we also want to protect the people we love and the people that we just come in contact with on a regular basis. And then lastly, even if you choose not to get the vaccine today, you can still get it at any other time, right? We should never be treating vaccination like it's a now or never discussion. And there are always ways that you can reduce your risk of getting sick. And so those harm reduction strategies that we talked about on the last slide. So I want to introduce you a little bit to the COVID-19 vaccine toolkit. So you've heard us talk about, or you've heard me talk about this COVID-19 homeless ambassadorship campaign, this toolkit that we're developing. So we've been working on this toolkit in partnership with local health professionals and homeless advocates. So I'm going to take a moment to give a quick shout out to El Rio, Pima County Health Department, Sharon Francis over at La Frontera, the guys with CCHS Foundation and Z Mansion, some folks with the Corporation for Supportive Housing, some folks at Primavera Foundation, and I apologize if I've missed anyone else, then of course my colleagues at the city. And so together we've been developing this toolkit of resources for folks to really kind of have this information, this more health information about COVID, more information about the vaccines, these really specific strategies for talking about vaccination, and a real meaningful understanding of vaccine hesitancy and why folks may be concerned about vaccination. And so there are a couple of tools that are available right now. So the first is our Homeless Advocates Guide to Discussing COVID-19 Vaccination with People Experiencing Homelessness. So it's a multi-page guide. It takes a look at introducing some of those key concepts of having discussions with folks about the vaccine, some basic information about vaccine hesitancy, racial trauma and its relationship to vaccine hesitancy, and then themes in vaccine hesitancy. And then it includes a table based on all those themes we talked about a few minutes ago in vaccine hesitancy of some of the most common concerns that people experiencing homelessness are reporting, the kinds of things we hear. So for example, I've heard that there's a microchip in the vaccine and that the government's going to track me. And then it will give you a set of sample responses that you can use to talk about that fear with someone or that concern. Right, and so we don't expect that to be a script. It's not meant to say, for you to just read off of a paper to someone, but to begin to understand like what are some of the most effective messages based on this concern, and then opportunities in there to be sharing your own personal and relatable experiences. So that guide is already published and posted on the website, along with the video that we showed earlier in this presentation. And so I encourage you to share this link with everyone in your organizations. Absolutely encourage them to take a look at the video, to download the discussion guide and take a look at that. And then we are wrapping up the final pieces on the vaccine toolkit this week. And so by Wednesday of next week, April 7th, we'll be posting the full toolkit, which includes an introduction to vaccine ambassadorship, the role of homeless advocates in promoting vaccination, this COVID-19 basics, COVID-19 vaccines, vaccine hesitancy and common concerns, effective strategies for promoting vaccine confidence, and then tools and other resources. So things like visual cues that we can use, signage that we can be hanging in our offices to encourage folks to get the vaccine, and also to indicate that we're a safe person to talk to about the vaccine. So some of those resources will be posted to this site next week. So I encourage you to check back there. We'll also send a notice through the TPCH email list when all of those last items are uploaded. But again, on the site already, if you were to go there right now, you would see the discussion guide, you would see that resource video, kind of introductory video. You'll also see a link to a form to request training for us to do a training as an in-service with your staff, or special training to talk about vaccine confidence. So an abbreviated version of this training, a 30 to 45 minute discussion where we really talk about how to have those conversations. And then there in the slide deck from today's presentation is there as well. So now I'm going to turn it over to Kat, who's going to share, this is a little different than vaccine confidence, and this is our last section before we go into questions. But this is about a really exciting upcoming opportunity for shelter and other homeless services in the area related to rapid on-site testing. And we want to make sure that you all have this information.
Yes, thank you, Jason. So we are going to be doing a webinar on Tuesday, April 6th at 2 o'clock that will be all about using Binax Now testing, which is rapid antigen testing. With this kind of testing, you get your test results in 15 minutes. And it doesn't have to be shipped off to a lab or anything like that. You also don't have to have medical staff to run this testing. If someone is trained, then they can do the testing, whether they're a medical person or not. So this webinar on Tuesday will have all sorts of information, all the requirements to get the tests, which we'll provide to your facilities for free, as well as requirements for reporting test results and the different supports that Pima County Health Department has to help you through this whole process. So if this is something that you are interested in, please email Jennifer Wagner, Jen Wagner. Her email address is on this slide. You can reach out to her and she will send you the email or the calendar invitation to attend the event on Tuesday. So that's it.
Thank you, Kat. That's really exciting and a new development that'll be especially helpful in congregate shelters, day centers, other places like that. It's really wonderful that the health department's bringing this option forward to the community. So now it is time for questions. So we've got about 12 questions in the Q&A box right now. So we're going to field those. And if you have questions that you would like any of the presenters to answer, please use the Q&A feature that is in the top or bottom of your Zoom screen, depending on where your control bar is. And we will make sure that we get them all answered before we wrap up. So our first question, and I believe this question is probably for you, Kat, comes from Victoria Macharski, and she asked, are folks able to walk up at all of the vaccination sites, or do they have to drive through at the, and I believe it's TMC, right?
Yeah, so TMC and Banner are both drive-through sites, and then all of the El Rio events, obviously, they can walk up to, and then TCC at the Convention Center and University of Arizona both have walk-up as well. University of Arizona, I would say, is the most handicap accessible. So if that is a concern, definitely go to that site. Because the TCC does have walk up, but you have to walk away. So I recommend University of Arizona for any disabled folks.
Thank you. And then another question. If someone has so Victoria indicated that she had a client that they scheduled for, but having an ID turned out to be an issue. So what can someone who doesn't have a state issue ID or a copy of their insurance card, what are their options?
Yeah, so ideally, they would have some sort of photo ID. It doesn't have to be a state issued ID. If they're pre-registered and can verify their date of birth and all that information, then they shouldn't be turned away. But if you do have like a specific case that's been an issue for you, you're welcome to reach out to me, and I will put my email address in the comments right now, or in the chat, and then we can work on some specific cases. But we're actually working on a process right now at the health department to work on this issue and to kind of have a formalized process for it. So hopefully it won't be an issue going forward, but yeah, if you're having issues right now, then feel free to reach out to me.
Thank you. So next question. When folks go to the vaccination sites, and so this question relates specifically to 2-dose vaccines. So if someone's going to one of the vaccination sites, they get their first dose. Will they schedule their second dose while they're there on site, or will they need to go back to the website and register for a second dose?
So they will go ahead and schedule that second dose while they're at their first dose visit. So no need to re-register, anything like that. All of the sites are reserving appointments for second doses. So that shouldn't be a problem to get the second dose appointment.
Thank you. And then this question I think is for you, Luis. So if someone is an El Rio patient, can they get the vaccine from their doctor or at the time of a wellness appointment, or do they need to go to a vaccine site?
So at this point, they have to go to a vaccination site, but we are planning to start providing vaccines when patients have their appointments. So I think we're pretty close, starting to implement that pretty soon. So as soon as we have the green light, we're going to announce it and let our patients know as well.
Thank you. And how would you address someone's concern connecting the lowest percentage of Johnson & Johnson? Oh, I think so. The question here is, and this certainly is a concern that's come up. So we know that in effectiveness to preventing COVID-19 illness, Johnson & Johnson vaccine has the lowest effectiveness rate of the three. And so how would we address someone's concern about being offered the least effective vaccine? And Logan, if I didn't capture that question correctly, please go ahead and shoot in a new question.
Yeah, so this is a great question and definitely a concern. We don't want there to be the perception that we're just giving this to the homeless population just to offload it onto them. So I think that there are some hypotheses out there about why it is less effective than the other two. And one of them is due to the high percentage of variants that were in the populations that Johnson & Johnson was using as part of their vaccine trials versus the other two vaccines. So we don't know how the other vaccines are going to protect against variants as much as we do have data on that from Johnson & Johnson. However, I would just emphasize that it's super important to be fully vaccinated. Our goal is that everybody's fully vaccinated. And with a population that moves around a lot, the easiest way to do that is with a one-shot vaccine. And so they can get one shot and be fully vaccinated and protected without having to come back. The other thing I would emphasize is that when it comes to hospitalization and death, that they're all 100%. They're in the studies, again, not real world data, but in the study data, they're all 100% effective at preventing hospitalization and death. And so I would just emphasize that in that situation, it is as effective as Moderna and Pfizer. But again, at the end of the day, if they don't want the Johnson & Johnson vaccine, then they do always have the option to go to the community site. And so they have that choice.
I would like to follow up with Kat. Actually, today I had a patient who asked me, which one is best for me? You guys are offering Johnson & Johnson, but I want to know if this one is going to protect me the same way. So my response to when a patient or a member of our community asks, I always say to them, all three are going to protect you from going to the hospital, and all three are going to protect you to potentially, not dying. So I want to make sure and let them know that all three of those vaccines are here to help.
Thank you, Luis. And being intuitive, Luis actually answered the next question that was in the Q&A, which was specifically which vaccine is the best. So thank you for that. So then the next question, what kind of ID is required? You mentioned it didn't have to be a state ID. And can undocumented community members be vaccinated?
Yeah, absolutely. Anybody who's here can be vaccinated, whether they're undocumented or if they're a snowbird or if they are a university student who's from out of state. If they're here in Pima County, they can be vaccinated in Pima County, so that's no problem. As I said before, ideally, photo ID is available, but if they're pre-registered, then they shouldn't be turned away without a photo ID.
Great. And so then the next question is, can we get a cheat sheet of examples of responses to common questions? And so I think to answer that question, so certainly is that sort of vaccine, the vaccine kind of concerns questions, that is that discussion guide that I shared that's posted on tpch.net/vaccine toolkit. Some of those just sort of basic questions about vaccination. There I'm wondering, Kat or Luis, does something already exist in that nature, or perhaps we can add it to the toolkit for next week?
I mean, I've seen the discussion guide, and so I was going to say that's it. It definitely has a lot of questions I think you'll get and some great ways to answer it. Those questions that are presented in the Z Mansion video, I think are also great in the way that they answer them. And so that's what I would go to personally.
I agree with the Kat and you, Jason, as well. I feel that those are two really good resources.
Thank you. So then we have another question. Have the Pfizer and Johnson & Johnson Janssen vaccines been shown to be just as effective in preventing death, hospitalization from COVID variants?
So that's a great question. So we don't have a lot of data on this at this point, on how specifically the Pfizer and Moderna will prevent variants. So we have some limited data. Same with Johnson & Johnson, really. So Johnson & Johnson was tested in South Africa. So we know it is about 64% effective at preventing COVID with the South African variant. There isn't as much data with the UK or Brazil variants. And this is all, I think, in the vaccine comparison chart. So the Pfizer and Moderna vaccines were really tested before the variants were widespread. So the only real data we have for Pfizer is in Israel, and it was about 94% effective, even though the UK variant is widespread in Israel. So there's not a lot of data about how it will protect from variants, but that's kind of the information that we have right now.
Thanks. And we've got just about 3 questions left in the chat box. So we're going to continue going through those, but we do have a fair amount of time left. So I'd encourage everyone, if you have additional questions, be sure to get them in now so that we don't run out of questions and close up before yours gets answered. So the next question, is it not advisable for people to take ibuprofen or NSAIDs to treat symptoms of the vaccine?
I think I'm going to let Luis tackle this question as a medical provider. So I know that, yeah, a lot of people have questions about if they can take medication to help with the side effects. And really, I would always recommend that people go and ask their provider if they have concerns about that. But Luis, take it away.
Yes, I agree with you, Kat. We should always have a provider on site, and if anyone has any concerns, they can always talk to them regarding that. I know that some of our providers have been recommending taking ibuprofen or Tylenol after the vaccine has been given to reduce the swelling, to reduce inflammation, to reduce some of the pain. But again, if the patient, the client has any concerns, we always have a provider on site, and they can further answer those questions to them.
Thank you. So the next question, do we have information about the effectiveness of the vaccine in preventing transmission to others?
You know, that's a really good question. I was like, yeah, that's in the chart, but that's not explicitly in the chart. So we have data on how effective the vaccines are at preventing you from getting COVID. I don't know of data, I will say, I shouldn't say it doesn't exist. I don't know of data that shows how effective it is at preventing spread from one person. So like from a vaccinated person to an unvaccinated person, or between vaccinated people. I don't know any specific numbers. I know a study did just come out with some Arizona healthcare workers. Some of the authors on the study were from right here at the University of Arizona, and they were looking at like asymptomatic spread, and it looks like the COVID vaccines are preventing that, which was some concern at the beginning. but it looks like that's extremely unlikely that that's happening. So I don't have any specific numbers to share with you, but hopefully as time goes on, we will get more and more data about that.
Thank you. And the next question, what do you feel is a good response to someone who's asking, how long will this vaccine protect me?
So again, with this, I would say we know that people have strong antibody response still 3 months after vaccination. And then the rest of the data is ongoing. So they're still collecting and analyzing that data for like the 6 months later, et cetera. So I would just say that, you know, the research continues and we don't have all the answers yet, but we know that you're going to be more protected with this than with no vaccination at all.
And this is our last question. So if you are holding tight on that last question you want to ask folks, this is your last opportunity to add some questions to the box. Our final question, when you go to a vaccination site, can you choose which vaccine you receive, or is there just one type of vaccine at each location?
So generally you can't choose, you just kind of get what's available at that vaccine site. And so the homeless population actually has more choice than most people in Pima County because the J&J vaccine is not widely available at this point. And so if people want Pfizer, they can go to U of A or Banner. But for example, I went to Banner and I was given Moderna. So you don't really have a choice. You kind of are given whatever they have available at that site.
Thank you so much. And so that wraps up our final questions. So we want to thank everyone for joining us today. I want to thank Kat Davis with Pima County Health Department and Luis Murillo with El Rio Community Health Centers for their incredible partnership in today's training, but more broadly in really guiding our work in response to the pandemic as it relates to people experiencing homelessness here in Pima County. And then one last plug for some resources here. So first, be sure to visit www.tpch.net/vaccine-toolkit. You can download that discussion guide that has those sample responses, other information there, as well as that introductory video. And then we'll be posting additional tools and resources there next week. I encourage you to schedule to email me or and so my email address is here, but also if you go to the Vaccine Toolkit site, you'll see a link to a form right there to request a 30 to 45-minute presentation. So a member of our team will come and do a brief presentation on the vaccine options and then registration, those items, and then really having those meaningful conversations with people experiencing homelessness. It's really talking about those effective strategies. And then lastly, for those of you who are working in shelters, outreach sites, other places where folks are coming in that you are open for service, consider attending the Binax Now testing webinar next week and exploring those opportunities to be doing rapid testing on site. And so to sign up for that, again, that webinar is on April 6th, and you can email Jen Wagner at the Pima County Health Department. Her email address is here, and I believe it was previously posted in the chat box as well. So with that, I want to thank you all for spending this part of your Friday afternoon with us. We know time on a Friday afternoon is a gift, and so we appreciate you giving that gift to this issue and all of the work that you're doing throughout the community to support people experiencing homelessness. Have a wonderful weekend, and if you celebrate it, have a marvelous Easter.
Thank you.